Hello, today's session we are going to be using the Theracane to get into the piriformis. We're going to do it quite deep, laying down. You're not going to be able to see right into the place that I'm pushing, so you're just going to have to look at my other videos. If you haven't already, look at my other videos where I'm in a better position to show you exactly where that point is. I will put pictures here and all that, and some muscle pictures and some point pictures. So the piriformis is a muscle that is really an issue for many people, for me and many others, mostly all my clients, and this is why I do this, so it's a place for you to come and find the references. As everybody who has this issue knows, that it goes up and down and up and down. Sometimes it's not bothering you all, sometimes it's like flaming, and it's just such an irritation here on your glutes, in this area. You want to be beautiful and whatever. Here you are in this agony pain. It inflames itself in many different ways. One of the ways that I find when I get really inflamed is because I was stuck in traffic. And you're stopping and going, stopping and going, stopping and going, and using those muscles and all that, and it just gets all tight. So on those days, when it's really bad, I really have to get into it deeply. I actually get into it all the time. You should look at all my different techniques. I probably use all of them at least once a month. So, okay. Again, always remember, breathe, breathe, breathe. It only works, this deep stuff, pointing stuff, if you're breathing. If you don't breathe, it can actually be not beneficial at all. It could actually hurt you. So breathing is the most important thing. Sometimes we tense. When you're tense, get aware of that and breathe and kind of come down. Either take the tension off so it's not so hard and breathe, or just relax and try to melt into that pain and melt it away. It's all about the breath is the key for melting all the pain away. Just as like an ocean, breathes in, takes the pain, takes away. The next time you breathe, you're already further relaxed. Good. There's so many things about breathing. I'm not an expert at that. You can go to other videos to find some other people who can teach you more about breathing. Okay, so let's start. Okay, so here we are, finding yourself in a good position. You can be in bed so you have more pillows. Maybe take some bolsters around, put on your knees. Probably going to be wanting to move your knees around anyways. We're going to be doing things like this, but a bolster helps. All of that, be able to get some weight off without using too much muscle. So always remember, we're trying to keep everything relaxed. We're tensed up, it's not working. It's to do it less and but released. No tension. Okay, so basically laying. The moment I put my leg up, so let's go ahead and just start in that position, and we're trying to find that point, which is right there at the top of the sacrum. You see the pictures, and we get into that point. So to start here very easily, you see I'm holding the stick, I can push it and I can go like that and it wiggles down here. Really very nicely. Just like that, just to start. If it's really bad, you might want to just start like that. Going around. Yeah, that works good. And just play around in there. Just letting the Theracane do all the work and trying to be totally relaxed. Laying down here, I kind of got to balance the knee, but if I come this way, the weight starts going down and you can feel it, but try to go there and release, because also that shortens the muscle a little bit, and then you have a different feeling starts to happen. So moving at the same time as massaging, moving the muscle, really is very effective also. Remember, always breathing. Whoa, so I'm kind of rolling up. I'm
I'm taking the point of that and going along the point which I feel is the length of the piriformis to the humerus. But if you have this problem, you're going to feel it. So I can totally tell when I'm going by it. So you just know it and you wiggle and breathe. Good, warming up. There we go. Oh, from a different angle a little bit changes it. Now from the other side a little bit. Oh, there it goes. All the way down. The best you can. So you can be very relaxed here. Okay. Very easy technique there to start. Let's go ahead and put the leg down and see how that changes it. And we stick that thing underneath there. Try to find it in a good point. And we just go up. Now we can really dig into it. Using all that angle in the Theracane here really makes it rise up when you're not doing so much pressure, so you can keep your body relaxed. Ooh, and breathe when you're going into it. Wiggle a little bit if you want. Hold it. If you feel yourself tensing, just hold it in one position and breathe and try to let go. Like, whew, so your whole body's clenching up. Hope you can see that. And then you just relax on it. And if it's too much clenching, you stop. And breathe a few times. Stop the clenching. No clenching. Everything relaxed. We're relaxing our body. That's what you need. Disengaged body. Ooh. So the whole process is on the piriformis, which we're doing, but if we're doing the breathing, we're relaxing all around, because if you're in a bad spot, you're in that high point threshold, pain threshold, then everything around for sure is tense. Check out my other video, which I will do on the psoas, and you might want to do the psoas first. Go back and do that first, because usually they're together. Whew. But this is the one we feel the most, so good just to get this out of the way if it's driving you crazy. And then you can go in the psoas, or back and forth. Sometimes I spend half hour to hour on both when they're in a really bad place. So that pushing it in and turning and pulling helps make that massage. Works great. Move it around. Just explore. Move it this way away and get it underneath, and then try it. As long as you're breathing and doing this, the tension is just going away. It's just washing away. Slowly eroding. Just erode it away by your breath, by bringing blood there. The blood all is going there now that we've pushed on it for so long now. Whole body is there. Your whole awareness is there. What is that? That's what's going to heal it. It's all that awareness, all this attention. Here I am in there a little bit and wiggling. Good, okay. So it's really hurting bad. So again, let's go ahead and try to be a little bit more even deeper. So I've pulled this up, so it's up, so I can get this in there. Really good on that spot. By now, you figure out where that spot is. So I've lifted myself all the way over here off the ground. I'm even off the ground. So I'm in an intense space. Now I just want to slowly disengage everything. Slowly, my hips on this side is dropping. Whew. I'm just letting everything relax and let that really dig deep in there. Trying to relax all those muscles. It's too intense. Go back, wiggle around again, go back and adjust and make it a little bit less and come back and do it again. And move your leg and try to disengage everything again. And really hold in there, really deep. And then kind of come out of it. You don't want to stay that deep for too long. Maybe in trigger point therapy, they say about 1 minute is enough. So we are getting a trigger point, but it's also a shiatsu point. It's all kind of the same duina. Same technique, different name. Okay, move around again. Oh, and then try it again by coming up and then going in there. Good. Now moving this leg. I'm moving this leg, opening this leg. Oh, that's intense. That's good. So opening the leg, because you're making the muscle shorter. So it's getting a different feeling of how you're hitting it. Trying to be relaxed. Might be a little bit of a tension, that's okay, but you just keep going, and then maybe you disengage here all of these muscles, but now I've just kind of let go a little bit more. Just keep concentrating on having all of the muscles relax and being in there. And breathing, breathing, breathing.
Okay, now okay, there you go. If you're feeling pain, no reason to be, just work on yourself. Work on yourself. Middle of the night, if it's bothering you, just get up and work on it, and they'll be gone. You'll get some good sleep and you'll have a great day. Remember, you are your body solution master, so you make sure you're not going too far, but still push yourself to really get the techniques, and you'll have the solution to help you on those extreme days. Check out some of my other videos, things I do just when I'm in the office or something, that you can get into that place very lightly, quickly while you're even driving. So just stay tuned. I'm going to have lots and lots more to come, and check out all the videos I already have to help you with all your chronic pain issues. I'm sorry about the light here. It goes up and down. That's just how it is. If you like these videos, please become a subscriber and share and like to all your friends and people who you know that have the same issues that you do. Have a great day.